Back when I was a college student, I went home over Christmas break and I had lost a significant amount of weight and I had extreme thirst and I had all kinds of the classic symptoms of type 1 diabetes. But at the time we thought I was just allergic to some sort of food, couldn't really figure it out. And then my mom pinpointed one day, she said, "I think you have diabetes, we're taking you to a doctor," and turns out she was right. When I was diagnosed, I had a blood sugar of 789 when normal is between 80 and 120. When you're first diagnosed, you have to be really careful about what you eat, the medicines you're taking, how much insulin you're taking, different things like that, because they want you to be regulated. Well, now that I've been doing this for about 3 years, I've kind of slacked off a little bit because the doctors kind of gave me the go-ahead. Like, as long as you know what you're eating in terms of how many carbohydrates, as long as you're giving yourself accurate doses of insulin to keep your blood sugar under control, you can do that. There are millions of people with type 1 diabetes, but no two persons experience is the same. For me, the hardest part of dealing with type 1 diabetes is getting low blood sugars. I consistently get low blood sugars because with activity or stress lowers my blood sugar, so I never know what my day is gonna look like. I actually got an insulin pump pretty early compared to other people who are diagnosed with type 1 diabetes. I got one probably 6 or 8 months after I was diagnosed, when normally they say like year minimum. With an insulin pump, it's consistently giving you background insulin to try and maintain your blood sugars as they are, and then instead of giving yourself a shot whenever you eat, you just press certain buttons and then it will give you insulin that way. Another benefit of a pump is you can wear a sensor that can automatically measure your blood sugars, and some people choose to wear it and some people don't. I do have one, but I personally like still sticking myself and measuring my blood sugar that way because I think it's a lot more accurate. And with a pump, you can have smaller increments of insulin, whereas when you're using shots or pens, they're larger increments of insulin, so there's a lot more room for error. So with a pump, my treatment is a lot more accurate and a lot more consistent. One piece of advice that I have for type 1 diabetics or people who have any form of disease or pretty much any form of struggle is you need two things: a good attitude and a good support system. Because you can have all the right tools to treat your disease and to help yourself, but if you don't have a good attitude about it, and if you don't have people who support you around you to help you do that, all of this is a waste.